Recording. Yep. Okay, so I just wanted to start off with introducing what this panel is for. So it's a part of the National Public Health Week, and our organization, Reproductive Health Interest Group, is hosting this career panel to let our members and just people of fielding know like what kind of options for careers there are in the reproductive health and sexual health field. And so I'm going to stop talking and I'm going to hand it over. I'm not sure if anyone wants to speak first. Maybe we can go alphabetical. Who is first? Adam, and then we can go to Alex, and then Emily, and then Lydia. If you would just introduce yourselves, your organization, kind of what you do generally in your organization.
Going first names alphabetical, not last names. My name is Adam Sukhija-Cohen. I am the Director of Advocacy and Policy Research for an HIV nonprofit called AIDS Healthcare Foundation, or AHF. You can visit us at ahf.org. I have been working in this position since 2016, and before that, while I was doing my PhD at UCLA at the wonderful School of Public Health, I was consulting for AHF. And in my capacity, I oversee a team of 12, a small but mighty group of researchers and advocates who focus on clinical device trials, as well as behavioral interventions and retrospective data analyses and prospective data collection, all for the purposes of addressing HIV and other STIs in the United States.
Should I just launch right into it? Hi, everyone. My name is Alex Hanel. I graduated in 2019 from UCLA. I got my MSWs and my Masters of Social Welfare in addition to my Masters of Public Health, so I did the concurrent program. And right after graduating, I joined LA County Department of Public Health. I worked there up until quite recently in a pilot program that was working within LAUSD and other school districts, creating well-being centers in schools that also provided reproductive health care in a partnership through Planned Parenthood Los Angeles. So we had, teaching and providing sexual education and different one-on-one resources, while also providing actual reproductive health care on campus for free, which was very cool. And now I actually work for Long Beach Unified School District as a middle school social worker, running a different type of wellness center, but it is quite similar to my previous position, except with middle schoolers, which is pretty crazy. Thanks for having me.
Hi, good afternoon. My name is Emily Chung. I graduated from the Masters of Public Health program in 2005 with Lydia. Hi, Lydia. And so my current position is I am the Director of Public Health for the County of Santa Cruz Health Services Agency's Public Health Department. So we are the local health jurisdiction, one of, was it 60 something in the state. And so we are a local government entity and have responsibilities across the spectrum of public health essential services. And so I oversee all of our programs, including communicable disease, health education, emergency preparedness, emergency medical services. We have, what else do we have? We have substance use disorder prevention services, HIV treatment, and of course, STD prevention and sexual health education. My earlier part of my career was much more focused on sexual health education. I also worked for LA County Department of Public Health in the STD programs and did programs with LA Unified and Compton schools on sexual health and working with teachers and middle school and high schoolers. And I worked for Planned Parenthood in high school as a peer educator. So long history of working in sexual health education, and I'm happy to share more when I get to the point of how sexual health led me to leading a public health department.
I
think it's Kate next. Yeah.
Kate is actually helping me moderate.
Okay. So, yeah, I was like, oh. Okay, then me. Sorry, Kate. My name is Lidia Carlton. My pronouns are she, her, and I am the Director of Community Education for Planned Parenthood, Pasadena and San Gabriel Valley. I supervise a team of 6 right now who do a lot of sexual health education in the community. Our affiliate, there are 7 affiliates in California, Planned Parenthood affiliates. We all operate fairly separately, and our affiliate focuses a lot on youth and foster care. So that is sort of a specialty area of this affiliate specifically. And prior to working here, I spent 11 years at the California Department of Public Health in the STD control branch, doing a lot of state level support of different local health jurisdictions and working with the California Department of Ed, primarily on primary prevention activities, education, and I did a lot of basically done sex education my entire career since graduating with Emily in 2005. And also Emily and I have just always been a little bit in the same world. I think that might be a take-home point, is that this is a pretty small world. So you'll just see the same people in the same places, on the same panels every time. So Adam, yes. Okay. Alex, I know we've interacted with you, so that's sort of the name of the game.
Okay, you want to go ahead and ask the next question?
Sure. Yeah. Thank you so much, everybody, for introducing yourselves. We're so excited to have you all here. So, as you know, we have a bunch of students on this call, and as we're getting to the end of the year, I'm sure every student here is thinking about where their degree is going to take them and what kind of jobs they're going to go into. So we were wondering if you could speak to the skills that are most important in your career. This can be, like data, hard skills, computer programming, or maybe things like public speaking. Just anything you feel like really helps you just do your work on a day-to-day basis. We can maybe just go in the same order, if that's okay.
Oh man, that means I'm first every single time. Okay, so my funny answer would actually be typing fast, because that was the first thing that my now boss noticed of me. I met him at a rig event before he would ever become my boss, and he noted that I typed very quickly. And the other skills that I would say that normally are not mentioned in public health that have worked for me in particular is actually like image and video editing software like Photoshop and Premiere. So that's just been incredibly helpful, because then we can kind of do the jack of all trades public health approach, because sometimes you just need to put together a flyer and it would take you 3 months to hire someone to do it, or you can just do it yourself. The more important answer, and I think the one that really helped me build the position that I have now, is scientific lit reviews. Understanding how to read journal articles, how to read the good ones, parse them out from the bad ones, analyze what their actual data analyses are, and then put together a summary of what you're finding, so you can either propose something, address an issue, or come up with a new research study. And I think having an adjustable writing style has been incredibly valuable. And what I mean by that is being able to write scientific papers, but also being able to write talking points for legislators, versus being able to present something to a local county board of supervisors, how to speak about public health issues in multiple stages of what you're working on. And then the last thing I would say is biostats. I think that there are not enough biostats courses taught, and you should take as many as hellish as they are, will help you tremendously in all aspects of public health, whether you're conducting the actual statistical tests or you are reading about them in a scientific journal. I think we covered it. We're all good. You don't have to ask anyone. I'm just kidding. Next person.
Yeah, thank you so much.
Next. Biostats was not my friend, so take more classes, because I could have used more of it for sure. I think with my position, it's a little bit different than the others. I'm very direct practice, so I'm working directly with adolescents. And like I said, my last job was with high school, and now it's with middle school, so anyone from 11 to 18. So I really need like public speaking skills. I really need facilitation skills. I run a lot of workshops. I do a lot of presentations with staff, with parents. So the ability to speak to just multiple different populations about the same topic and be super, super flexible. Working within a school system, I mean, working with any system is always requires some degree of flexibility, but working within schools specifically, you never know what's going to happen. There's a crisis every 5 minutes, and especially working with adolescents, it's an unpredictable and impulsive group of students. And a lot of mine come from a very high level of trauma and just family history that they bring with them to school. So just having a ton of flexibility and I would say ability to just navigate all the different types of folks that walk into a school. You're working with lots of different organizations, so there's tons of different partnerships. My last position, it was PPLA, it was Department of Mental Health, it was the Department of Public Health, various different schools and school districts. And so just really, and especially I'm relatively young. I think I'm the most recent graduate. So also understanding my worth and knowing that I did deserve a seat at the table and building that up in my self-confidence, that's been a huge skill that I've had to just build on and continue to work on. And lastly, I would say probably teamwork. I think working with so many organizations, just going back to the team and our shared mission, our shared goal, and continuing to work on team building skills has been really helpful for me.
Great. Yeah, thank you so much. Emily?
Yeah, thanks. Well, much of the things that Adam and Alex said, I agree with. My funny answer, kind of like Adam, is multitasking. Like, get really good at multitasking. Whether it's typing while listening or, being able to, think about a couple things at the same time. It's not great for the brain, but honestly, in your career, you're going to find yourself doing that more and more. Not saying you should do it, but it happens. But really, totally agree on public speaking. Generally, oral communication is super important. And with that, it's the collaboration and relationships, being able to build rapport and trust with any partner or client is super important in all careers related to public health and reproductive health. For me, in the local government sector, the type of skills that I think are really important are understanding the nuances of public government and how we are governed. Like we have, at least in the county, we have a board of supervisors that ultimately governs us, and we're accountable in a local health jurisdiction to the state as well. And so that kind of layering of understanding our policies and the mandates around that are helpful if you're interested in government work. Policy work too, knowing how to read policy, how to interpret laws, and how to advocate around legislation is a great tool in any industry of public health. Another hard skill that I think that is that we don't get a lot of training in public health is related to project management and also budgeting and finance. I don't know if Professor Prelip still teaches it, but he taught this really great grant writing class when we were there. I wrote him back years later. I'm like, this was so helpful. So really one of the most like skill-based classes I ever took when it comes to like hard skills, right? And so I encourage learn how to write grants and do budgeting and finance, and how to do project management, like real project management skills. So I would say those are helpful. So yeah, I think that's where I'll pause now. Thanks.
Y'all stole my responses, except I don't need biostats. That, Adam, that is you. You. But for sure, budgeting, like if you were talking math, budgets, understanding like line item budgets, budget revisions, all of that. So I mean, I feel like I learned a lot of that on the job, but if you have the opportunity to look at grants and look at funding opportunities to see what they're asking, and I think some of those like very classic public health skills, I feel like an MPH is like a degree in writing a grant, basically, because it's like people with MPHs write the RFPs for grants. So they're like, we want a SMART objective, and that is very, very much like the world that we live in. So that, I think grants is particularly in the nonprofit space, like a big portion of that skill set. And then in terms of soft skills, I just would encourage, this is like so dorky, but if like, just be cool, like be cool. This is not a big field. So if you're like, you should be nice to people and stay in touch with them, because as you go along in your career, you would be surprised like who's there for you, who goes where. Look at Emily, so fancy, director of public health at Santa Cruz. That stuff is real. Like it really happens that people either stay in their position or move into different places, and so that can be really key. So I think being just kind to each other, which you would be surprised how much people are unkind sometimes too, because people get burnt out, they get hurt. There's a lot of trauma in this field, so that comes through in a lot of the work that we do, especially in a pandemic. So that's all for me.
The
thank you so much for sharing.
The pre-lib course is CHS 485. I looked it up.
Yeah, that pre-lib course, like, should just make it a requirement. I feel like I tell everybody who like interns and people who info interview with me, I'm like, take that pre-lib course, please.
Yeah, unfortunately, he could not offer it because he had to teach 211. But yeah, I was very much looking forward to that course as well. Maybe he'll offer it next year for all the first years in this call. Thank you all
Smart
for
objectives,
your
smart
insight.
objectives versus grant writing, which you have to pick and choose, I guess, with pre-lib.
Yeah, I'm not happy to hear the biostats one as well. I will be forgetting that you said that, Adam. So jumping into the next question, I'm gonna kind of combine these two of if you could speak a little more to the advantages and like disadvantages of working within your specific sector, whether that be government or school or research, and kind of talk about like the aspects that are appealing about that sector, your specific role, and kind of the aspects that are, less appealing.
Are we still alphabetic order here?
Maybe we should switch up the order so that we don't have to always have Lydia going last and Adam going first. Should we just go maybe start with Alex this time? So Alex, Emily, Lydia, and then Adam.
I'll try my best. So I've had two very similar jobs, but in two very different capacities. One working with LA County and government, and then one working as a school employee. And I would say one appealing part of both jobs was that it's chaotic, but I really like it. I like that I need to be on my toes. I like that every day is really different. I like that I work with all these different types of people and all these different organizations, and it's just lots of moving parts, which I really enjoy. A bit of a double-edged sword, because it also means that you don't really have any peace or quiet, and it's just kind of chaos all the time. And I would say in terms of the second part of the question was advantages, disadvantages. I mean, I didn't really enjoy the government side of it, which is why I left after 3 years. It was very rigid. It didn't give a ton of room for flexibility and growth, which wasn't ideal for the program we were trying to run, because it was a pilot program operating under the Substance Use and Prevention and Control Unit. And it didn't always click. And so now in my current position, because it's run by the district itself, it's kind of more of an insular program. There's just way more opportunities to be creative and flexible, and there are fewer kind of check boxes we have to mark off because we're just not answering to a government entity. So in that case, it's a little bit different. I hope that answered the question. Yeah.
So for me, I'll start with least appealing. In my current role, I would say least appealing, similar to what Alex said about government. Government is, as everyone knows, a little bit challenging. So the bureaucracy, the slowness in which things take to happen, that's the hardest part, the least appealing part of working in government. Systems change and government change takes time and patience. I also find that real honesty here is like personnel management, like managing subordinates, is hard. It's not necessarily the least appealing. It's just one of the harder parts of a job when you start becoming a manager or supervisor. Most appealing of the work I do, my current role, I can really do, to me, like the purest form of public health, which is the population level programming and work, and to direct the systems changes around that for a county of 280,000 people. So it's just really exciting to be at that level to influence all different types of health areas. including sexual health. In my previous jobs, when I was focused more on reproductive health, like when I was working with LA County and in schools, I loved the collaboration and being in the school setting, and actually even teaching. I loved the teaching the sex ed in the classroom. So that was fun. So sometimes I miss that. I miss that direct work and the health education side of my training. So there are moments when I kind of wish I could go back and do some of that once in a while.
Sorry, I'm like coughing. I think of my career a little bit in terms of I worked for the state for so long, so that's a lot of my sort of career identity. So I'm going to answer both, working for the state and working for a nonprofit. And I think in that state role, I think having that level of impact is really like what Emily is saying, especially at the Department of Public Health in California. It's like such a big impact, even though it's like under-resourced and you're working really hard, but you can do very small things that have very big changes. And that's really lovely to kind of get into this work and to have that kind of influence. And I do think, I mean, I kind of when I need to, or I can work around it, or I like had the bureaucracy at least was clear to me and I could operate within it. So that was appealing because it felt manageable. The pay was not appealing, straight up. The state does not pay well. It doesn't pay well, at least maybe later in your career. So something to consider is like when to work in these different environments in the course of a career. So if you're younger, maybe it's a good time to, like, I feel like I started in a nonprofit, but then I went to the state, and I think that was a great way to like really hone my skills. So that was appealing. But also the pay. And then in nonprofit space, I really, what I'm not adjusted to and what I don't love is being so driven by grant funding, sort of like that is, you have to like really go for funding to support your staff and your programs. And then the relationship in the nonprofit industrial complex, which is like rich people form foundations, they dole out their money very carefully and tell you exactly what they want you to do. And then you have to report to them what you're doing. That dynamic bothers me. That's just like my little radical heart hurts in that space. And so I struggle with that. And then the appealing part, however, is that I'm closer to the community. We have a youth program. Those young people are like super queer, super radical, super fun to be around. And that's really nice when you're starting to feel disconnected from what you're doing. So, and maybe Alex has that experience too, of just like when you're actually around students, it can be a little bit more grounding and exciting.
I'm going to double down on what Lidia just said about the nonprofit world. 100% correct. A smaller nonprofit that is driven by grants could actually go under, not because of the lack of funding, but because of the requirements of those grants. Because sometimes they become so prohibitively detailed and nuanced that you can't actually achieve what you want to achieve without essentially collapsing from all these different grants. Or conversely, a grant could be pulled that was a half your funding, and it could be pulled at a whim by a state or federal agency, and that's the end of your nonprofit. I work in a weird nonprofit. My research program within AHF is a rounding error. AHF is a huge organization. It serves almost 2 million people, has a $2 billion budget in 45 countries. I am a very small 12-person team in a domestic research. So the work we get to do, the advantage of it is research is not the priority of the organization. Advocacy and services are. So I get to kind of meld myself within the advocacy and services and evaluate those programs and conduct our own research. The disadvantage is I do have to bring in some level of income to show that we're not just relying on the organization for survival. And so as a result, we combine two different types of work we do. The first is the work that feeds the organization's needs, whether it's talking about advocating for HIV/STI services at the local, state, federal level, putting together reports and publish papers and editorials about the issues that AHF is advocating for. On the other side, I do have to work with other organizations or other companies or other universities that are trying to conduct research, whether it's a new device or trying to get FDA approved and they need samples from participants. We would recruit those participants and get paid for that work. But some of those studies I don't want to do. But you have to do them sometimes because you want to keep yourself afloat and be able to work on the projects you do want to work on. So there's nonprofit work can be very, in what Lydia said again, 100% accurate, can be very, very frustrating, just as government work, I'm sure, can also be frustrating with the bureaucracy. And so you kind of have to focus on finding organizations that align with the mission, that their mission aligns with what your interests are. I've always wanted to do HIV STIs, and AHF is a perfect match because that's all I do every day, and I love it. But I could imagine if you have to focus on something that you're not as interested in, it becomes harder to want to keep working for that organization.
Great. Thank you, everybody, for sharing. Okay, so the next question is, as you sort of reflect back on your education and your career trajectory and where your career is at now, could you speak to some things that like definitely helped you in that trajectory, and then some things that maybe you thought were going to be helpful but ended up not really being that helpful? And this time, let's start with Lydia and then go Emily, Adam, Alex.
Yeah, biostats not helpful at all. I think, you even sent us these in advance, and I'm like a little stuck. But I do think epidemiology. I loved taking epi classes in school, and I think going to a Department of Public Health, being like epidemiologically literate was really helpful, even from a sort of programmatic community programs person perspective. I've always worked in education, primary prevention, but a lot of that work looks like translating concepts that happen with surveillance data and different studies, like what Adam's talking about, and like translating that for populations to understand, like, why do these disparities exist? Here's the disparity, but like, what's behind these numbers, and how do we get here? How do we get from A to B in terms of what I'm talking about and what I'm presenting on? So I think that's been, I don't think I anticipated how important that would be, and I'm glad that I feel like I got like a really great, somehow the mix of professors at the time was really interesting to me. I did not anticipate I would like that going into school at all. And then let's see, I think I'll pass it to other folks, and then if I want to chime in, I'll add more things. But I do want to, I guess I'm just like an epi hype person.
Great.
Okay, my turn. Specifically about education and career, I echo kind of the epi side of things. A lot of stuff on epi and surveillance right now, data in general, learning more about, gosh, do they teach health informatics now? Like, I think more on that. That would have helped me right now, more on health informatics, which I guess touches on biostats, which helped me a bit, but not as much, I think, because I didn't end up doing a lot of biostats in my career. I think what I will say is, in your time at the School of Public Health, it's going to be about not just what you do in the classroom, but all the things you do outside of the classroom. So RIG is a great example. And Dr. Cattle, Paula, hi, like really cultivating this type of group of a network and networking and staying connected to the UCLA and the School of Public Health alumni community has been powerful, right? And I think has helped me in my career, at least in seeing familiar faces in places, or knowing who to kind of email and talk to if you have a question about something. I mean, I've certainly reached out to some of our professors in the past, like, gosh, almost 20 years later, Lydia, 20 years, almost 20 years later, that those connections are still there, and I still feel like I could reach out to people. And that's really helps in a career when you think about your career is not a singular path. Your career is not going to be a straight line either, right? My heart is in reproductive health. Like I said, I started reproductive health as a teenager and did it up until purely reproductive health work for a really long time. But I did a lateral career change about 8 years ago, and moved to do work that was more about policy and governmental stuff and health, but more policy and not public health, not reproductive health. And that was hard, but those are the kind of risks and challenges you want to take sometimes in your career, and having a network to go back to and rely on and work with to get advice or questions on is really going to help you. So I guess that's my summary is in your education, don't forget about the extracurriculars and the people and the professors that are really going to help you beyond just those 2 to 5 years you're there.
Great, thank you. Yeah, go ahead, Adam.
I would also say RIG. RIG is the reason I have the job I have now, because RIG was the one hosting the event where I met my now boss. So I would say go to as many RIG events as possible and meet as many people as possible. Even if you don't think the topic is going to be interesting to you, you don't know who you might get to meet afterwards for drinks, or going, during the dialogue and asking a question that just might spark something. So I highly recommend participating in all activities. If you're interested in reproductive health, focus on RIG. RIG does have a lot of great resources. Dr. Tavro has a ton of great resources. And she also teaches, and I've said this before, the best class I ever took during my master's program, which was reproductive health in sub-Saharan Africa, because that class, I knew nothing about reproductive health in sub-Saharan Africa. And I learned a lot about that, and I learned how to critically read journal articles. And it was more helpful than any class I took, except for I guess, Dr. Prelip's class. But it taught me, it prepared me best for the comprehensive exam as well, which I took a billion years ago. I know people don't, biostats is a hellish course. I've only had nightmares because of biostats. I think EPI kind of aligns alongside that. Like, I think you can say EPI and biostats, because it teaches you how to understand data. And that's what's the most critical part. Everything we do is data. Everything is population-based. You need to understand how to read data. And so taking biostats and EPI courses, I'm going to concede to the EPI, are critical. More than what they expect you to take. Take more.
I'll try not to be repetitive. But I think when I look back on my education, I'm a little bit odd because I did the other degree. And I think that really shaped what I wanted to do and how I want to use public health, because specifically with social work overlaps so much with community health. And a lot of times I think when programs are created, it's social workers or some similar type of role that ends up actually executing those programs. And so I really appreciated having that understanding. And I feel like specifically working at the LA County Department of Public Health program, I was the only MSW there. And when I left, we had a bunch more on the team for a reason. Like, those skills overlap so much with public health. And I'm just super grateful that I was able to kind of see both sides. So if you have the chance to even just take a different course outside of, public health, I do think it lends itself to a lot of just kind of seeing, what it might look like for someone who actually is the one executing whatever program you'd like to write. It's just been really nice to kind of see both sides of it. And then looking back specifically, definitely joined RIG. RIG's amazing. Dr. Tavro is amazing. I used to be the Bigsby assistant, and I loved it. And working with her was I learned a ton. And then with all the internships I did at UCLA and during, even just during college, I always knew I wanted to do reproductive health. And so I really tried to find internships that looked at reproductive health in all the different ways I could possibly look at it. So I could kind of figure out what road I wanted to take. So I did, teaching and program planning and grant writing, and just trying to get really varied experiences within that one field, which then helped me kind of figure out what I want to do.
Thank you, everyone, for your insight. That was very helpful to hear. I guess since you all kind of gave advice about, the industry and like what we need to do to get a job in this industry, if you could share more about, more resources that you haven't discussed previously about how to get a job in the industry, whether it's your specific field or just public health in general, or any of your previous roles. I don't know, maybe Emily can start, and then Lydia, and then Alex, and then Adam.
Sure. I kind of go back to what I said earlier, networking, right? Best way to find a job is to get noticed before the job even opens. So if you are going to rig events or other UCLA type events, other events in the local community, if you want to stay in Los Angeles, I'm sure there's a lot of things you could do. Internships, Alex mentioned that. I think I did a couple internships at UCLA, and starting even as I started as a part-time data collector for actually a project, and that's how it got me into promotion. I kept promoting up through the nonprofit, and it opened doors for me. So take internships, take part-time jobs while you're in school, so that you can explore and learn about different parts of public health. There are so many things you can do in reproductive health. You just heard 5 different people with 5 very different paths, right? So don't be afraid to try a job, even though if you're not sure it's of interest to you. But if you're interested in local government, most local governments have student worker type positions. So while you're in school, you could work for a local government and get paid a small amount of money, and it could be for any type of program. So look into that, in whether it's LA County, Orange County, or if you're somewhere else. And then if you're interested in government work as well, I think this is very specific and nuanced, and Lydia can probably understand this. Government job applications are very different and challenging. So if you want to work for a government agency, spend some time researching the application process and talk to other people that, through your networks, like use LinkedIn, whatever. Talk to the people who work for that agency or a similar one to figure out how to apply and do it the best way possible. There's a way to do it, and it's different for every agency, but you have to kind of understand the system to get into the system. I hate to say it, but so if you're interested in local government, or any government agency, that's probably one of the best tips I can give you if you want to get in there. So, find people in the networks you have to talk to and learn more about what kind of jobs there are and how to apply.
Related to that, keep your transcripts. Like every government job, they want you to pull from which class you took, how many hours, and how that applies to the job description. So since you're in a transcript situation now, hold on to that thing.
Yeah. They will actually ask for them in government jobs. Please upload your transcripts. And I'm like, what? So make sure you save them.
Yeah, the state application, usually you have to get on a list, which involves a very long process of linking every single experience you've ever had, how many hours of doing that skill you have done this thing. We're talking about hours to apply. But I think, I'm not sure for every county job, this is just the state, but in general, once you're on a list, you have crossed at least the finish line for one piece of the hurdle for a category of a job. And then it's a little bit easier, more normal for the remainder of getting those jobs. So it's a lot of work. And I think a lot of MPH people who get MPH degrees, you're very well aligned for government jobs. That is an MPH is kind of government-y. So don't rule it out if you're somebody who's also that's not for me. I don't want to be part of the system. If you're one of those people, I'm happy to talk to you about being a person like that who works for the government. But I think it's worth considering for sure. If you're going the nonprofit route, I don't know. Does anybody work for profit public health, that's like a whole, I would love that panel. I would participate. I'd want to listen in on that panel. But for nonprofit folks, I feel that being sometimes, depending on who's hiring or what the role is, describing what a public health degree is because I don't think it's a well understood degree in general. I describe it sometimes as an MBA for community health, because there's a lot of similar skill sets and people understand what MBAs do in a lot of spaces. You're doing project management, you're doing budget development, work plan development, all of those things. And I think sometimes if you're looking for a position, you're like, I have an MPH. They kind of get it. They know I know stuff about public health, but you really got to talk about those skill sets. So I would just say that's been my experience, at least in government settings and public health departments. Almost, at least in the state, you have to have an MPH for a lot of positions, so people get it. You all have a kind of shared language. But outside of those spaces, there's like a little bit of explaining and a sort of describing what your core skill set looks like. And then I would also say, like, if you have lived experience and have, I'm not sure what folks are coming to this space with, but don't be shy about sharing your lived experience too, because I think in at least in my spaces, that is really valuable. It's more valuable than your academic credentials in a lot of spaces. So if you feel comfortable sharing those experiences, that can be really compelling in terms of where you go, where you land, and what your career trajectory is. And also just, I'm here to say that is also, I know you're working really hard on degrees, but you are more than your degree, and you can bring that to these jobs as well.
Honestly, I don't even remember the order. Maybe we just do Alex and then Adam.
Sure. I'm gonna triple down on the networking for sure. That's just, it'll be lifelong, and thankfully UCLA has an amazing network. So you're already set up there. I think also when I got my county position, I got it in kind of a weird way. So get creative with if you want to go into that space, because it can be really difficult to get. Like Lidia said, there's a list process and the application's a nightmare, and you don't actually know until you're in it, which is very bizarre. So it was a contract position that then became a permanent county position. And so it was a great way to kind of dip my toe in and see if I liked it. Turns out I didn't like it, but I'm really glad I tried it. And it was my way of being able to kind of, learn from that space and figure out how the application would look if I want to go down the road. And now I kind of figure out how LA County works and why I don't like it very much, but it was really valuable. And I'd also say it was my first job out of grad school, and I specifically wanted a position that worked with lots of different organizations within LA. Like I really wanted to kind of just meet as many people as I could. And now I have great relationships with a bunch of people at LAUSD, with a bunch of people at Planned Parenthood Los Angeles. I know some folks at Department of Mental Health. And so I feel like it just really expanded my network. And I specifically wanted that for my first job out, just to meet as many people working in as many places within that space as possible, so that moving forward, I can just kind of hopefully, explore different positions and bounce around and be able to continue to network with all those different folks.
Networking is always going to be key. And I also would add, for when it comes to participating in RIG and the events that RIG had, I just said yes to everything. If you want to go to the dorms and teach about sexual health while giving them cookies? Absolutely, I do. Do you want to go to a youth homeless clinic and help out with the services that they need? Yes, absolutely, I do. I just wanted to participate in everything, because it's important to learn also what you don't like as much as it is what you do like, to help you kind of figure out what you want to do in your career. The other thing that's beneficial is once you're in, at least in a nonprofit setting, once you're in the nonprofit, it's much easier to then make the connections with the folks in the, let's say, in the departments that you're more interested in working in. So AHF has a lot of job postings. They have HIV testing counselor positions, MA positions, et cetera. If you apply and start as an HIV testing counselor and you showcase skills that may be better suited for other programs or other positions, it's easier to kind of just talk to the HR and say, hey, I'm already here. I'm already in your program. I just want to move over to there. What can I do to make that happen? And there could be pathways they would create to say, you know, eventually we're going to need a new program manager for this place, or we're going to need a new research person over here, and you're already in. And you can connect with them on Teams better than anyone that's outside the organization, because you can just chat right with the person that's in charge of that position. So I'd say if you're interested in working at a specific place because it aligns with your mission or goals or interests, I would just look for even any opportunities there and then use that to kind of venture into the position you want.
Great. Thank you so much, everybody, for sharing. This is super insightful. I think that now would be a good time to open it up for questions from anyone who's here. So feel free to drop your questions in the chat. Oh, sorry, Emily.
Sorry, Kate, I just want to say one more thing, and I'm not pushing government work, but we do need more people in public health and government, I'm telling you. So I will say one thing that maybe hasn't occurred to you at this early stage in your career is your retirement. So when you work for an organization, whether it's a government agency or a school district or wherever, they have pensions. And there's something nice about that to work and know that one day you will have a retirement plan in place. So it's not the only reason, money is not the only reason you should take a job, but if that's something that hasn't occurred to you yet, think about it. And I've been trying to market that for new career people because government work has its value in that sense.
Yes,
well,
definitely.
Social Security is going to run out in 2034, so that's a good sales pitch right there.
Okay, so any audience member, anyone who's here, please feel free to, unmute, ask your question, or you can put it in the chat if that works better for you. While everyone is thinking of their questions, I'll just take another minute to say thank you so much to all of our panelists. It's been such a great discussion. And I think it's so easy as a student to get caught up in just the day-to-day survival of like, oh, I have to go to class, I have to do this reading, I have to like be ready for tomorrow. So it's super helpful to just hear from people who have the perspective of having gone through the program and now can kind of show us what it looks like to take a step back and like reflect on the bigger picture of like what a career in public health looks like.
If no one has a question, I do actually have a question for everyone that's worked in a government setting. You mentioned that the application is tricky. What would be the best resource to like look into in order to apply other than reaching out to people?
So a lot of government agencies do offer like resource fairs and opportunities to talk to their personnel about how their personnel HR folks about their applications and job opportunities. So you absolutely can ask, like directly ask, like, how do I apply? Any tips, call their personnel department. But yeah, if you can find somebody that has worked for a similar agency or that agency and ask them how, some tips and tricks for the how to apply, that's probably a good route. I'm happy to, I've coached a lot of people on county type. I've worked for 3 different counties now. So I can tell you how to apply for a county. I don't think I can tell you how to apply for a state, but I'm happy to talk to people who are interested in county type jobs.
For the state, I don't know about all departments, but I know the Office of Health Equity does webinars about how to help people apply. I also don't think you know until you're in it and you're like, oh, I'm in it now. I am now 4 hours deep in this job application. So you just have to like get right with your soul before you go into it. I will also, and then Alex, you were reminding me, just as for folks who might be thinking about government jobs, is that a lot of government employees are contractors. So I think all of us, Emily, I think you were a contractor too with USC. Is that right? I was.
Yeah, we had some weird thing where we like got in as a nonprofit, and yes, they converted us. Yeah.
Yeah, there's a lot of like weird stuff that happens with those government positions. Like I was a UCSF employee when I was at the state. So my paycheck came from UCSF, but you would have never known. My email address was CDPH, all of that. I was a government employee, but That can be better for your pay a little bit, depending, but also just keeping an eye on like Public Health Institute, PHI is a very big contractor with the state and I think different county governments. So there are certain like contractors who work with government agencies as well. I don't know. I can't like name all of the contractors, but just it's worth keeping an eye on lots of different opportunities, even if you're looking for government roles.
Thank you. That was really helpful. Yeah, I feel like county applications, I looked at it and I was like, no, this is another language. Maybe another time.
It's doable. Don't get overwhelmed. Just, it's about it's just like anything else. It's project management, getting organized, having everything in front of you. Like, if you want to talk about it, I'm happy to talk about it. So happy to share.
Does anybody else in the audience have any questions? Feel free to pop them in the chat or just unmute yourself.
A great way to network for future jobs is to ask questions.
I actually have a question. Thank you so much for being here. It's not really like a job or academic question, but if you could just share like one of your favorite moments at FSPH, like outside of the classroom. Because as Kate mentioned, I think we just get so lost in like classes and assignments, we forget just like that the whole school is here. So if you could share just one of your favorite moments.
I really like the School of Public Health talent show. That was really fun. They stopped doing that, I think, like in 2010 or so. So it's been quite a while.
I was a commuter, and really, I'm not gonna lie, y'all. I was like, I need to get in and out of this program as quickly as possible. I finished a quarter early, was done. So my experience is maybe a little bit different. But I did field studies. I did field studies in Kenya with Paula. And I think that was just a really, that is very school related, but I think I did not want to do global work. Very glad I did, because I was like, this is not for me, but I've learned an enormous amount. So taking on something that I was like, this is just a UCLA, like I happen to get money to go here. That's incredible. I'm really glad I did that.
Lydia, you can say your favorite moment was saving a quarter's worth of tuition.
I did that too, Lydia. I actually finished a quarter early. I don't know if you can do that now, but it was very doable back then. I think my favorite kind of rig related event, gosh, I think it was rig related, was when a bunch of us from RIG went to DC and we marched at the to protect women's reproductive health, if I remember correctly. Yeah, I remember going with Kristen Schellenberg, Lydia. And we have some great pictures of us wearing like, t-shirts saying like, something about bush and touching our bodies or whatever. So we got to march, and it was, and I don't know if it was sponsored by the school at all, but it was definitely like we connected as RIG members and say, we need to go to this march. We need to go do this. And a group of us went and had a really great time, and it felt impactful. It felt meaningful. It's a really good memory, and I have stories I share with people about that still. And again, it's not this, but it wasn't classroom based. Yes, you okay, Paula, you did subsidize that trip. It was a Bixby event, and it was great. So take advantage of those things, right? Like Bixby program is unique and really cool. So definitely use the things that they offer. It's amazing.
I can go next because I didn't know what to say, and then you mentioned the march. I was at FSPH during the previous presidency, and he was elected while I was there. And I don't know, the sense of community was just really helpful, and a bunch of us did end up going to the protests, and it was just it was really nice to be with so many like-minded people who prioritize the same thing I prioritized, and it was just a refreshing group of people to be surrounded by. So I really enjoyed that. But all the Bigsby things were amazing. Also, Adam mentioned Sex and Cookies. I loved teaching sex. It was so much fun. It was ridiculous. You literally bring those, what is that place called with the cookies? It's delicious.
Diddy Reese.
Thank you. Yeah. And you just get to hang out in the dorms with a bunch of freshmen basically and answer all their questions. It was really great. And just a fun way to teach as well. So all that kind of stuff was awesome.
All right, so we are almost at 6 and want to be respectful of everybody's time. But again, thank you so much to all of our fabulous panelists. This has been such a great event. And we really appreciate you all taking the time to come talk to current students. I'm sure you remember what it was like to be a student thinking about like, oh my God, what am I going to do after this program ends? So thank you again. We really appreciate it a lot.